Well, this week marks 1 year since the first confirmed case of COVID-19 was found in Canada. The first case in northwestern Ontario was recorded in March. Since then, the region has seen nearly 1,200 cases and 27 deaths. Most of those cases, just under 900 of them, have occurred in the Thunder Bay district. The job of trying to stop the virus from spreading and containing outbreaks when they happen has fallen to Dr. Janet DeMille. She is the medical officer of health for the Thunder Bay district. Dr. DeMille has been joining us really almost weekly since the pandemic began, and she is on the line again with us today. Dr. DeMille, good morning.
Good morning, Amy.
Thanks for joining us once again. So when I said that 1 year since those first cases, have you had a chance to let that sink in?
It's almost surreal, it feels. Like this has been quite a year. Mm-hmm. And when I think of a year ago, what we were doing, kind of just learning about this virus and sort of starting to understand maybe some of the implications, but really perhaps not really knowing what was ahead of us. So it's to think of where we were then, the first wave and navigating over the summer, it has really been, I would say, a roller coaster ride.
Yeah, I think a lot of people could identify with that into where we are now. I mean, everyone's lives have changed. I can only imagine how your life has changed. What has it been like for you?
You know what? Very ups and downs, very intense, I would say. Lots of sort of ups and downs, lots of times of hope for sure, and also discouragement. And I appreciate you talking to me, but I have a lot of staff who I feel are likely experiencing the same thing, right? And the sort of the intensity of their own work, because I might be leading this, but they're the ones doing the work, so I know that they're really impacted the same way, and it's really challenging, it's really intense, and just having to keep one foot in front of the other and keep moving forward. And I think we've had a lot of successes in terms of how we've managed this virus, both, I would say as a health unit, but also as a community and how we've managed the virus. But certainly we're still not in the heat of it. And, I compared it to a roller coaster, and that we're still on the roller coaster.
Yeah. What stands out to you from the past year in terms of lessons learned? Because we have learned so much has changed.
Well, just from, we've learned a tremendous amount about the actual virus, and we see in our own work, the decisions that we make are much more guided by evidence and, clear guidance and guidelines about how to handle certain situations, and that has evolved. And so that's really, I think, helpful, but at the same time, we still see sort of an ongoing evolution of that. Like when we talk about the variants of concern, right? The UK version or and the potential implication that could have for us. I think it's still kind of uncertain. So kind of navigating through that and trying to manage.
And that new variant, as that starts to pop up in Ontario, how are you watching that? What is that like for you?
Well, there's a lot of provincial work, Public Health Ontario, the ministry doing work on that, and there is testing being done in certain situations, including a testing that might be done up here to do that surveillance, right? So we're kind of being guided by the direction of the scientists and public health experts, like at Public Health Ontario, regarding this. And it's certainly concerning. It seems like something that could spread very quickly in whether a particular place or in a particular community, and that would have implications for us and our community if we started to see it here before. But we've also had our own experiences with sort of super spreading events or situations where we've had to deal with significant number of cases. So we've just got to keep going.
Is there any testing being done to see if that variant pops up here? How will we know?
There's certain flags or criteria. For example, if somebody were to come from the United Kingdom and they might be returning in our area, and that if they're isolating, like the quarantine period, and they develop COVID, that would be a sample, for example, that would go for more testing around that. If we had a situation of very quick spread somewhere, that might also be a situation where that would be looked at in more detail.
So I'd like to touch base with you about some of the current outbreaks in our area. Can you bring us up to speed on the situation at the jail and the correctional center? What is the latest there?
So both continue to be active outbreaks, and we're working with corrections and the Ministry of the Solicitor General to really manage those particular situations. They're obviously, very complex outbreaks to manage, and where they are complicates them and the impacted population, and of course we're looking at sort of inmates and staff who are at risk, and so it's always strengthening as much as possible those infection prevention and control practices, cohorting people, keeping the people who are positive, separate from the people who are negative, and repeated testing. So we're just doing, repeated testing, even of people who have no symptoms, just to pick it up and to manage it. And, I think that I anticipate that these are going to be hard to control. I just looked before we spoke. We are reporting more cases linked to the jail this morning, and that's that's concerning. It says there's still a lot of work to be done.
I also wanted to talk about the stay-at-home order that is currently in effect, and the issue of enforcement. Something that I wonder if you can help me to understand how that's working at this point. How does the responsibility for enforcement break down between health officials and, say, police or other officials?
So there's an enforcement group that has always been in place, really, and that involves ourselves, the city with their bylaw officers, for example, the police here in Thunder Bay, and other police departments, as well as other people who have specific responsibilities in certain areas, right? And it's about working together and reviewing, the complaints. And there's a process to sort of handle complaints sort of during working hours and then after working hours, and lots of discussion when it's often more than one party is involved on any particular complaint, and then the decision sort of how to handle that.
Okay, so it could then be someone from the health unit, or it could be someone from another enforcement office then? Am I understanding that?
Yeah.
Yeah? Okay.
Yeah.
And so how does that work in terms of, are you usually going out in response to a complaint that you get, or are people out in the community actively looking for people breaking the rules? How would that happen?
So I think it's a combination of both, right? I mean, we do a lot of work, like as it relates to, say, businesses, and at times when they're open, for example, we do there's inspections that happen by different parties, actually, at different times for things that might be open, right? Even I didn't mention sort of Ministry of Labor and Occupational Health and Safety even has sort of inspections, happening. And I think, so there's different types of inspections that happen. And of course, we do have our complaints line. So if people have, are seeing something themselves, we follow up with that. And if we get certainly a series of complaints about a particular situation, and it's maybe something more significant in terms of a violation of compliance, then we would more aggressively follow up on that.
What would be an example of that? If somebody was willfully like a business that was willfully sort of violating certain, like the masking or physical distancing or the measures that need to be put in place, and we would get, and if we got recurrent kind of complaints, we would take a more aggressive approach to that. We often, public health inspectors, start off with sort of education, making sure people are aware of the actual, the rules and what's expected of them, and then sort of escalating that through the various series to in a progressive way to more stronger enforcement. But sometimes, if there's a gathering, a party, and people might be, willfully doing that, then we would be more actively sort of following up and getting the evidence, gathering the evidence, police gathering evidence, and potentially laying charges. And you mentioned the complaint line that you have. Are you able to give me a sense of how often you get calls to that line?
So I think we get calls fairly regularly, and we follow up, and some of them are, perhaps don't pan out, or when we follow up on them, maybe there was just a minor kind of an issue, and others, and again, we have a sense of where, the big ticket ones are, like if there's sort of broader violations that we keep hearing up, then we would do more, assertive enforcement and involve other partners.
Dr. DeMille, before we wrap up, I want to touch on something. We've talked about this in the past, but just the sense of fatigue that is out there, the sense of fatigue with the restrictions. We've heard some municipal leaders now start to echo some of those concerns as well, and ask to look at more of a regional approach. And I know you've said in the past that when you feel it's safe to do so, you will advocate for things to reopen here. How will you know that it's time to do that? Is there a threshold you would be looking at?
So it's really the broader picture of what's happening, and it's what's happening in the whole region. It's also looking at what's happening in other northern health units, because they have sort of similar issues or characteristics as we do, and connecting with my colleagues, including Northwestern Health Unit, because we're the two in Northwestern Ontario, looking at healthcare capacity, hospital capacity. That's a big one. Looking at our actual numbers, then we have to be careful about the actual number and sort of over-interpreting it, but understanding what we're seeing in the patterns of our cases. So, one outbreak that's sort of fairly confined to one facility can look like pretty unpleasant in our numbers, but they may not have a direct impact on the broader community. So really looking at that, looking at what's happening across the province. So right now, there's a really an optimistic trend across the province of the numbers declining. We, unfortunately, are one of the few health units where our numbers are actually going up for, known reasons. But looking at what's happening in other jurisdictions, because what happens there also impacts us. And it's that broader collection. And it's looking, to be honest, I don't always agree with what's actually written in the legislation that we have to apply here. And so maybe advocating, but you have to follow the rules if they're written in legislation. So trying to, where I have opportunity, sort of influence, well, let's not target this particular situation, but this one we should target. And that might be looking at sort of the pattern of spread we've seen in our community or in other northern health units, or even what's happening even in other health units, and making sure that we're kind of taking an evidence-based approach to this.
Dr. DeMille, really appreciate you joining us once again. Thank you so much for this.
Thank you, Amy.
Dr. Janet DeMille is the medical officer for the Thunder Bay District Health Unit.